Good morning. Today's topic will be ECG, and the learning objective are being able to interpret the basic ECG, being able to recognize a STEMI and recognize D wave changes and interpret PR interval and recognize any different ECG rhythms. What is ECG? The full form of ECG is electrocardiogram. And ECG is just you get an ECG strip in your wards, and I know if you're a medical student, if you have been in the wards, usually your consultant, your RSR, anyone, they take out the ECG strip and they give it to you and they're like, read it and interpret the findings. And I know it had happened to me also multiple times. So to be less embarrassed, I will go on with some basic stuff so that you will be able to interpret a basic ECG and the common different ECG rhythms. So what's ECG? ECG is electrocardiogram, which is then what happens is in an ECG, in electrocardiogram, when the heart pumps in single heart pump, in the ECG we can see that single heart pump in form of electrical activity which are shown as wave formations in the ECG strip. I hope it's clear. And here, these are the components of the waveforms when there is an electrical events during one single heartbeat. As we already know, there is P, Q, R, S, T and U. What is P? As we already know, P is when our atrius contract, it forms an upward wave known as P. And then this QRS complex is due to ventricular depolarization and ventricular contraction. And the T is the ventricular repolarization. What happens is, as we know, a single a physiology of how heart pumps. First of all, the blood comes from the inferior vena cava and superior vena cava, drains into the atrium, right atrium, and from right atrium it goes to right ventricle. In the ventricles contract and it goes from the pulmonary artery to the lungs, and from lungs it gets oxygenated, and from there it goes to the left atria, and from left atria it goes to left ventricle, and from left ventricle aorta comes out, and aorta supplies oxygenated blood to all parts of our body. So that's important for us to remember. Okay, this one I've already explained. I want you to remember is this one. P is 2 to 3 small squares. Remember this. 2 to 3 small squares. And here I've given some duration like 0.06 to 0.1 second, but I want you to remember this one single small box here is 0.04. Let's remember that, and it will be easy for you to calculate. But here, for easy interpretation, remember this 2 to 3 small squares. P. Then the QRS complex, which shows ventricular depolarization and contraction, which is 1.5 to 2.5 small squares. I usually take as 3 small squares here. Remember that, the QRS complex, which follows the P. And after that, the other thing that we have to remember for an ECG interpretation is the PR interval. So, what is PR interval? It is the time taken for an electrical signal to travel from sinus node to the ventricles. That means, for the ventricles to contract, the electrical signal should go from the sinus node to the ventricles. And this is usually 3 to 5 squares in duration. And the other thing is this QT interval, which is 9 to 11 small squares. And this is the representation PR interval here, and this is the QT interval, and this is the QRS complex. And I also it's important for us to know this RR interval. It's important later on when we have to calculate the heart rate. And this T wave is the upward deflection during the ventricular repolarization.